Schools across the country are seeing a surge in drug abuse cases by students who have found clever ways to smuggle and consume the drugs without detection. The most affected are elite private schools, whose students have cash to spend on all types of drugs. Lukwenja Benjamin works with Boundless Mind, a mentorship program purposed for students in schools. He shares his insights in schools so far covered when it gets to drug abuse.
You're very rarely going to find people admitting, or young people admitting that they're having sex. But also you're not going to find schools and school administrators admitting that these things are happening. The problem exists, and it's something that we need to confront.
Reports of students struggling to catch up or engaging in habits adopted during their time away from school have been rife. Substance abuse was one of the bad habits fueled by the pandemic. Benjamin believes the models need to change.
What we need is additional training for teachers to cover these sorts of areas that are now emerging and have direct impact on whether young people are able to complete the school cycle.
It's on this background then that school counsellors advocate for mental health needs of all students by offering instruction that enhances awareness of mental health, appraisal, career and social plus emotional development, and referrals to community resources for a long time. We paid a visit to St. Andrew Kagwa Gombe High School, and a couple of students shared why schools need full-time counsellors.
As a young person, a lot happens. Some are mostly academics. You can fail somewhere, and you feel like you're so low to move up or to get up and move on. And you feel like, what can I do? You get to go to these counsellors. So
maybe sometimes if we have conflicts with each other, it's easy for us to go to counsellors to counsel us.
We have what we call a safe space. This is a place whereby you know you're going to pour your heart out and it won't really go to the DC or anything. This is your emotional part, and you're talking to someone who is experienced, someone who's learned, who is so good in that field that you know you're going to get help, and at the same time you're going to stay in school.
Talk about many things. First of all, how they're affecting us academically. We mostly focus about the academic parts because we all want to come together and then see what we can do so as we can raise our grades.
Shema Wasi, a peer educator in the school and her community, shares how the lack of community counsellor costed the life of a friend.
We had a group Face Up campaign, then we could every morning text, everyone explains how the night was, but she could send, I would call them suicide notes, will you remember me, such words, and we could all ignore. But then one day, we all get to know that she committed suicide.
For Wasi, some parents are judgmental, explaining the detachment from the students.
Sometimes we fear they're going to judge us. Why did you go in for that? Why didn't you tell me before? Why are you telling me now? But then a counsellor will be like, accept, yes, it happened. Yes, so how are we going to move through this? Yes, we get this. These are the steps, how we're going to move through this. And at that moment, we don't need judgment, but we need comfort and working through the situation.
Atwina Immaculate is a school counsellor and shares why their role is critical than any other.
Most of these students in school, some copy from back home from their parents. That you find some parents use these drugs, they involve the learners, they involve their children, some even send them to buy for them.
Students have a range of push factors that trigger their worries and later manifest as depression and anxiety.
This school should also engage the learners because when the term opens, we usually have that session first, in that first week. We talk to them, we encourage them, we advise them, we tell them to open up in case they could have experienced it at home.
The prevalence of mental illness in children has reached an all-time high, and it's a public health issue that up to until recently has been widely ignored. Counsellors are a vital part of the educational team, and in an ideal world, children would have adequate access to school counsellors. When left unmet, students' mental health needs can pose serious barriers to social and educational development. Counsellors are a necessary part of an educational staff as they have a unique qualification required to provide education, intervention and referral services to children, parents and teachers. Kyamagero, NTV News.